Alright guys, we have another question coming up. Hey Dr. Islam, I have gastroparesis. What are some treatment options for this? Let's discuss this in a little bit more detail. So what exactly is gastroparesis? This is delayed gastric emptying. One of the more common reasons is diabetes. Diabetes can affect everywhere in your body, including your GI tract, your stomach, your colon, and your small intestine. When it affects the stomach, it leads to a condition called gastroparesis, or delayed gastric emptying. This is when your diabetes doesn't allow your stomach to contract fully, and so you feel like food is just stuck in your stomach all the time, doesn't want to pass through. You have a lot of nausea and vomiting for that. What can you do? Well, first thing we recommend for anyone who has gastroparesis is to change their diet. You need to be on a small, frequent meal all throughout the day, like you're grazing all throughout the day. And this is one of the very uncommon reasons why I recommend to not take a fiber supplementation. Fiber has been shown to make gastroparesis symptoms worse. So don't do that. It's going to make things worse. It's making you more bloated, more distended, and not feeling very good. So try not to take any fiber supplementation. Go low in fat as well, because fat wants to sit in your stomach and not pass through as it's going through the GI tract. It's another thing you want to maybe not do as well. And then number 3, have small frequent meals all throughout the day. Do not have the 3 big meals like you normally have. Your stomach cannot tolerate that. It doesn't feel good when you have it. And it needs just these small frequent meals all throughout the day to help you to digest better and to allow things to pass through a lot easier. These are some natural options we recommend. If that doesn't work, we have some medical therapies that are out there that can help out with the motility of your gut, depending on the degree of gastroparesis that you have and your main symptoms as well. So if you have this condition, come see someone like me at Lubbock Gastro. We can get that taken care of. We can evaluate, do you actually have gastroparesis? Because it's a specific diagnosis that we need. We can talk about what other treatment options we can offer for our patients as well. Let me know in the comments down below if you've tried different options for gastroparesis. What has worked? What hasn't worked? I would love to hear what you guys have to say.